the beholder. Body weight misperceptions among African Americans. Body weight status misperception, perceiving oneself to be thinner than one's body mass index (BMI), is growing in the United States. At risk for lifestyle-related disease, African Americans face more dire consequences with respect to this misperception than others. In a sample of African American Kentuckians, we found a moderate level of body weight status misperception. Educational attainment was the strongest predictor of body weight status misperception, with more education associated with less misperception. These findings suggest that health communication for African Americans should address body weight status misperception and be tailored for individuals' level of educational attainment. Social comparison does not always result in body image disturbance. Festinger 1954 and Wills 1981 suggested that the motive for social comparison, e.g., self-evaluation, self-improvement, self-enhancement, can influence whether an individual experiences poor health outcomes. Research has also shown that different comparison targets result in different consequences. Martin and Gentry 1997. Helgeson and Mickelson 1995 noted that when common bonding, i.e., creating bonds with others, was a motive for social comparison, peers became the target. A lateral comparison rather than an upward idealized image from the media. Body image in the African American population. There is ample evidence that racial identity moderates body image development processes, especially among women. Bada 2000 found that Black women's body perceptions and satisfaction were less affected by upward social comparison than white women's body perceptions and satisfaction. Two main explanations were posited for this finding. First, Bada noted that most female body images found in the media were white, suggesting that Black women may have discounted images in the media due to incongruent racial identification. Second, the women in the study may have held different ideal body shape standards than those depicted by the media, suggesting that common bonding prompted lateral social comparisons. Bada's findings corroborated racial differences in body image noted by Kemper et al. 1994 in their study of college-aged women. Richmond and Associates 2012 noted a similar trend in their longitudinal data from 1994 to 2002, reporting that Black women rated increasing BMI over time as more attractive rather than less attractive, as was the case in other races. More recently, Thomas and colleagues 2013 found that Black women in midlife had higher BMIs than white women, but were significantly less likely to indicate that they thought they weighed too much. In this study, Black women were also 14 times more likely than white women to say they weighed too little. Similarly, Watson et al. 2013 found that a strong multiculturally inclusive racial identity can serve to shield African American Black female college students from negative body image and disordered eating behavior. Recent studies have looked directly at African Americans' levels of body weight misperception. Smalley, Warren, and Morrissey 2017 found that rural, economically disadvantaged African American patients with diabetes and/or hypertension were nearly twice as likely than their white counterparts to underestimate their actual weight. Men were also noted to be more likely than women across both racial groups to underestimate their weight. Nakshizadian and colleagues 2014, in their sample of Hispanic and African American Black outpatient clinic participants, found that those with a higher measured BMI were more likely to identify an inflated ideal BMI target than those with lower measured BMI. Both of these studies, however, were conducted with individuals receiving some sort of health care from a clinic or care center. Given that obesity interventions have been less effective in African American communities than in white communities, Wingo, Carson, and Ard 2014, more studies are needed to expand our understanding of the existence and extent of body weight misperception within the general African American community. Additionally, despite several studies focused on racial differences in body image and perception among women, few studies have investigated the link between gender and body weight perceptions in the African American population. Health communication. On a national level, 47% of non-Hispanic Black adults are obese. Hales et al. 2017. Furthermore, African American Black adults in the U.S. continue to have an increased risk for obesity and obesity-related chronic illnesses such as high blood pressure, heart disease, type 2 diabetes, and stroke. Benjamin et al. 2019. Especially concerning is the fact that these health problems are starting at younger ages in the African American population, as compared to white. CDC 2017. Given this reality, the issue of underestimation of one's weight status is a more serious concern among African American communities. From a health communication perspective, the first-line treatment for obesity is the promotion of health behavior change, often through comprehensive lifestyle interventions. Jensen et al. 2014. These interventions are commonly based on models that predicate behavior change on a person's perceived susceptibility to a disease. The health belief model is one such model in which perceived susceptibility to a disease is an important antecedent to individual health behavior. Skinner, Tyro, and Champion 2015. It then follows that if people who are overweight or obese underestimate their body weight status, they may not realize that they are at an increased risk of developing several chronic illnesses, which could undermine health communication campaigns' effectiveness and healthcare providers' recommendations. Furthermore, underestimation of weight among overweight and obese adults in the U.S. is associated with decreased likelihood of wanting to lose weight and decreased attempts to lose weight. Duncan et al. 2011. Therefore, it stands to reason that body image may be one factor that contributes to racial disparities in obesity and obesity-related chronic illnesses among African American adults in the U.S. Ladies, own your body and invoke the principle of loving the body you're in.